Hi guys, this is me Gayatri Akhil and welcome to Quality Online OET. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about 22nd of July 2023 OET exam in which OET writing. There were two letters have been asked. One is a known case letter and another also was a known case letter. So let's move on to the case note. So the first letter is we are writing a letter to the patient GP because we are just refer back to the patient GP. In that, patient name is Annie, who is 60 years old, and patient got admitted under gynecologist, and that was referred by her GP only because patient was suffering with recurrent urinary tract infection, and it's been since 2018. And also patient was under work pressure, and also she was using the inco pads due to her dribbling of urine and recurrent urinary tract infection, and she was so embarrassed herself that she is using the inco pads. And apart from that, she was going through mental pressure also due to her condition, and she was referred by her GP to a gynecologist. So after listening her complaints, the gynecologist made an assessment on her. From her assessment, she came to know that she is suffering with a stage 2 uterine prolapse. So she just she was just commenced her pessary insertion treatment, and she was okay with it. And also she discussed with her about the surgical option, but the patient refused the surgical option at present, and she said to the doctor, when my symptoms get worse, so I can move on to the surgical option. At the moment, I just go for the pessary insertion, and the pessary insertion also happened in a successful way. And now the gynecologist from the gynecology department, the nurse is writing a letter to her own GP to make a follow-up assessment and management, and also encourage her to do some exercise. And also she has a further follow-up on 6th of February 2023. So the GP is going to take back the patient to assess her condition and also provide her treatment and management until the follow-up. So we are writing this letter to the patient's GP. So when we are writing a known case letter, usually we no need to write about the social background of the patient, which includes her living status and also her habits and also her past medical history and medication history. That is not at all necessary to write it in this known case letter because the GP is already known about her full history. Only he does not know after she reached hospital what was happened to her and then what kind of the treatment that she received from the hospital. So that information the GP will not aware about it. So the nurse is writing this letter to the GP, what was happening during the hospital stay and what kind of the treatment that she received, and once she go back to the GP, what the GP has to do for her. So that the information is more than enough for you to write it in this letter. So that's why we are calling this one as a known case letter. So as usual, writing a date on the top of the paper, and then we are writing the address, so that will be the patient's own GP address, and then we are writing a salutation, and then we are going for the reference. There we are writing a patient name and date of birth. Then you are coming to the introduction. So in the introduction, who has successfully attempted, like that also you can write also who is recovering from the problem of stage 2 uterine prolapse problem, so because they have done the pessary, so that you can write, or else who has undergone, like that also who has undergone pessary insertion following a stage 2 uterine prolapse. Like that in the introduction you can write full stop, she requires your continuous monitoring, she requires your continuous monitoring and encouragement for exercise programs. So like that you can write it. And now the present medical history, she was admitted so and so date because that was referred by the GP only. And then on the time of admission, she presented with the complaints of so and so problems because she was so disturbed, and also she was mentally not stable, and she was embarrassed about herself, and also she was suffering with recurrent UTI since 2018, and also she was so depressed about herself. So these all things on the admission they have noticed. So on assessment they have diagnosed her with a stage 2 uterine prolapse, and then she was treated with pessary, and she was discussed about the surgical options. However, the patient refused the surgical option at the moment, but she was okay in the future that if her symptoms get worse. So these things are we are writing in the present medical history paragraph. Then coming to the recommendation paragraph, because we are not writing the social background over there, isn't it? So we are coming to the recommendation paragraph, what the GP has to do. So the GP has to take a take over her back, and also he has to monitor her conditions and provide further treatment option. And she has a follow-up appointment on February, and then he has to encourage her to follow some exercise regimen to keep herself good. So these all are the informations that we need to pick it from the case note, and we have to write it. So this is the known case letter. This is a one type of letter. And the next letter, they have asked the same known case letter only. Here we are writing a letter to the rehabilitation center where the patient was already stayed over there, and then patient just came to the hospital to treat herself, and now we are referring her back to the, which means transfer back to the same rehabilitation center. So here the patient name is like Lina Hine, and she is 87 years old person, and her diagnosis right leg DVT, and she is a widow, and also she is a lecture person, and she got admitted on 5th of January 2023. So she was brought to the emergency department with a red swollen hard painful right leg below knee, and also she suffered with lightheadedness, dry lips due to dehydration and confusion. And on the assessment, they came to know the patient is suffering with DVT of right leg. And then the treatment option, patient was treated with the pain relievers and also blood thinners warfarin, and also they have given 48 hours of IV fluids for the dehydration, and then she was given paracetamol as PRN. And then eventually her symptoms are subsided, and she started to walk with a walker. So now we are writing the letter to the same rehabilitation nurse, because where she was stayed, and now we are going to discharge her back to the same rehabilitation center. So we are writing a letter to the rehabilitation nurse who is going to look after her again. So what is the recommendation? Which means the nurse must monitor her medications up to next doctor review, and also the review is on 10th of January 2023. And also they have to continuously monitor her INR, because the patient is on warfarin blood thinners. Of course they must do the blood checkup of INR, and then they have to encourage the patient to do some physiotherapies, because exercise will make her good, and also it will enhance the blood circulation to the affected part. And then they have to make sure that she is hydrated, and they have to check the hydration status, because she was admitted in the hospital due to her dehydration also. So these things they have to make sure. So here also we are writing the address, writing the date or address, either anyone, we can write it on the top of the paper in the left side, and then we are writing the address, and then we are writing salutation, patient name and date of birth. Now coming to the point of a present medical history paragraph. So in the introduction, as usual, we have to write the patient diagnosis, who is recovering from right leg DVT, deep vein thrombosis, full stop. She requires continuous monitoring, and else what else they have to do? She needs continuous monitoring on medication and the exercise regimen. Then both things you can write it. And then coming to the point of present medical history paragraph. So Miss what is her name is Heine. So Miss Lena Heine was brought to the emergency department on this day 5/1/2023 with the complaints of red swollen hard painful right leg, below knee right leg, along with the lightheadedness, dry lips and confusion. On assessment, she was diagnosed with DVT, right leg DVT, and during hospitalization, she received pain relievers, blood thinners of warfarin, and IV fluids for 48 hours for her dehydration, and paracetamol as PRN. Unfortunately, her symptoms are subsided, and the patient started to walk with a walker. Also, she has undergone continuous INR monitoring. And now we are writing the recommendation. Here also it is not necessary to write a social background and past medical history of the patient, because patient was in the rehabilitation only until she got admitted in the hospital. So it is not mandatory, because the nurse who is going to look after her, she is already knows her past medical history and the social background of the patient. So here also we can completely omit the social background of the patient. And then we are recommending to them what the nurse has to do after the patient reached to the rehabilitation center. So the nurse has to do, she has to monitor her medication compliance, because she is on warfarin blood thinners, and also she has to regularly monitor her INR, and she has a doctor review on 10th of January 2023, and until that they have to monitor the INR. Also she has to encourage her to compliance with the physiotherapy regimen, because the physiotherapy regimen help her to enhance the blood circulation and improve her mobility further. And please make sure her hydration status, as she was admitted with the dehydration, so that's also very important. So the both letters are known case letter, because when we are writing the known case letter, the positive part is we are not necessary to think about the social background and past medical history of the patient. patient. Only the thing, since the date of admission until the date of discharge, what was happened to the patient and what they are going to do for your patient, the person who is going to look after the patient after the discharge. So that's the one thing we have to write it, and we can write it elaborately in a very concise and a clarity manner. Okay, I hope you all have done in a good way. So whomever wants to join in our class, we have 40 days, 20 days, 30 days, and also we have a beginner's batch, and we are separately taking online speaking as well as online writing correction. So if anyone interested to join in our class, our number has given in our description. You can contact us at any time. So until then, bye bye.